Her name was Mary, and her 90-year-old mother had a stroke, a bad one. It left her mother in a coma and on life support. Mary didn't know what to do. How long should she keep her mother on life support? This was a crucial decision, and perhaps the best decision that she would have to make for her mother. Maybe she didn't understand what the neurologist said, or maybe she just didn't want to believe that there was no brain activity. She consulted with another neurologist, and she had the information that she needed to make the right decision and the last decision for her mother. My name is Laura Watier, and I'm a patient. I'm a patient advocate, and this morning as I was thinking about this, I'm also now officially a patient activist. My experience in healthcare is I was a patient advocate for hospitals. I have 15 years in the pharmaceutical industry. I'm a volunteer firefighter, emergency EMT technician, emergency medical technician, and I believe in patient education. Raise your hand if you want complexity in your life. I don't. But I do believe some fundamental things, and one of the things you've heard when you have your health, you have looking at this not from the top down, but from the bottom up. And one of the things that I think is empowering to patients is education. And to that end, we develop health. And many of you who are in the industry may know E-Patient Dave, and he said that the most underutilized resource, our gross product in healthcare is 20%. And back then, it was almost 15 billion. And they were looking at one of the root causes that can change that, and that was simple communication. So why do we need a more simplified system? Patients need a more convenient way to get education. Patient education empowers them to make the right decision. Patients help reduce healthcare costs, and patients plus health education equal better outcome. Right now, a patient can access education through many different mediums. Hospitals, pharmaceutical companies do it, medical device companies do it, advocacy groups do it, community groups do it. And across the nation, we have 5,600 hospitals, over 50 advocacy groups, hundreds of pharmaceutical companies, community outreach groups, city, state, and federal, who are all patient education. Employers also. This is just a list of over 100 pharmaceutical companies. Here's a list of 50 advocacy groups. So if I was a patient, and here in Atlanta, we have almost 500,000 people here in Atlanta, your local hospital is probably offering maybe one. I think what we can do is ask that everybody that provides patient education collaborate, so that a patient, if searching for any type of patient education, most of which you offer free, can go to the website, enter in the zip code, select their healthcare education of interest list of how you could travel to get here. Similarly, we can do that with healthcare. This is our website right now. It's very easy to use. Again, in your zip code, select the area of interest, the radius that you're willing to travel, and I guarantee that moms, dads would be willing to travel for their children a lot farther than 25-mile radius if it was that critically important. So why am I healthy? Because right now it's critical. We want to not just reduce health care costs, because yes, that's important, but the priority is to provide the information to the right patient at the right time. So in terms of a business plan, competitors, ironically, nobody is doing this right now. Nobody is asking all health educators to collaborate. The caveat is, in order to be part of the system, is that the providers who are providing patient education have to be accredited. Doctors, nurses, practitioners, dietitians can actually post their works there. And it's old school. Old school in the sense that you can actually go there, talk to a physician, ask and get a question answered. We're going to allow teleconferencing expenses too, but for right now, we're offering as an initial startup. We're starting in Kentucky and Indiana, and hope to be fully launched. This is new. It's creative. We'd like to partner with you. Mostly, what we need is a collaborative effort to say, yes, we will partner with you. We see the value of educating patients. We see the power of that, and we'd like to work with you. So my ask of you today is to upload your patient education programs on My Health Can Create account, and then you watch your attendance grow. So I think now is a good time for us to collaborate together. Collaboration really equate to the patient winning and equate to lower health care costs. So I just want to thank you for your time.